Okay. Hello, I am Betty Hyman with RabbittApp, and we are going to take a look at this document, the Agent's Roadmap. We are going to um, cover what is the Affordable Care Act. We're going to really delve into what the ACA plans are, some important insurance terms for you to know, some information that is specific to the ACA, the Affordable Care Act, such as the enrollment dates and other dates that are specific around there. The next section, we will talk about RabbittApp itself, and we're going to talk about who is using RabbittApp, who our customers are, which are the general agents and the insurance brokers. And we will give you information so that you better understand who our customers are and how they enroll their clients with us. So we're going to start off by talking about what is the Affordable Care Act, also known as the ACA. Other people call it Obamacare. So the Affordable Care Act was signed into existence under President Obama, and it did look to reform the healthcare system by giving Americans access to quality, affordable insurance. Really, what it does is it says you are no longer tied to your employer for your insurance. If you do not have an employer, if you're unemployed, if you have a very small business, which today would mean less than 50 or 100 employees, and your employer does not choose to supply health insurance, you can still buy in on an exchange or a marketplace along with the millions of other individuals who are in the same boat as you. So this Affordable Care Act decided that they were going to sell to the whole group of individuals who before did not have access as a buying group or the power of a buying group to come together. And they started selling insurance products on an exchange. Now, let me be very clear. People say, I don't want to pick up Obamacare, or I don't want Obamacare as my insurance. There is no such thing as Obamacare as far as a product. So it's not like if we were sitting in a doctor's office, I would have Cigna and the person next to me would have Aetna and the person on my left would have Obamacare. That's not how it works. The exchange holds products from insurance companies. So on the exchange, there is Cigna, there is Aetna, there is United, or there used to be before they pulled off. But there are Blue Cross Blue Shield products, Molina products. These are all name brand products that are offering specific health insurance plans on exchange, meaning they are participating on the Affordable Care Act's exchange. When you start hearing from insurance agents that might ask, do we also carry off exchange items or off exchange products? That only means that it is the Aetna product that's available in New Jersey, but it's not available on the exchange. It's offered privately through health insurers. The difference between on exchange and off exchange is merely the insurance companies who are choosing to participate in the exchange are considered on exchange, and those that don't choose to participate are called off exchange. It's important to know that when you are looking at exchanges in healthcare, the Affordable Care Act dictates that every state has to offer this state exchange or federal exchange. Every state has to offer their citizens access to the Affordable Care Act's platform. And the state gets to choose whether they are a state exchange by hosting their own platform, or whether they are choosing to co-op into the federal exchange, which means that the government, the federal government, is putting out an exchange where individuals from across these 34 states that you see listed here are able to go and purchase items. What it is important for you all to note is that if I live in Pennsylvania, I can only choose to purchase health insurance from a Pennsylvania carrier listed on the Pennsylvania portion of the federal exchange. It does not mean that if there are 34 states participating, I'm in Pennsylvania, but I want to go buy a plan in Florida. That doesn't work that way. It's still going to be organized by where you live. It is merely a question of whether or not your state participates in the federal or state plan. Who is eligible for the Affordable Care Act insurance? It is the same for every typical insurance. A person must be living inside of the United States. The person has to be a US citizen or lawfully present. There are certain visas that do allow individuals to participate in the country's health insurance platform. The person cannot be incarcerated, and when you qualify for Medicare or CHIP, which is the child health portion of Medicaid, you are not qualified for ACA insurance. You are relegated to either Medicare or CHIP. So when we look at the Affordable Care Act and we look at the exchange model, the way that way that insurances are classified, they're classified by metals. So you go from bronze to silver to gold to platinum. And within those categories, insurance companies will potentially offer a bronze plan. So you might have Molina offering a bronze plan and a silver plan, but you might have Blue Cross Blue Shield offering across all metals. When you look on the exchanges, you can categorize the insurance that you can get based on these levels. And you can see on the description that's here in front of you that the bronze has the lowest monthly premium, but then is associated with the highest cost for care, which means that if I don't go to the doctor very often, I'm young, I'm healthy, I want to pay the least amount of money out of pocket. And when I do go to the doctor, I'll suffer the consequences of having that higher cost of care. Now, compare that to the platinum, where you have a very high monthly premium, but then when I go to the doctor, I'm paying far less in copays or in deductibles. So before I get to copays, deductibles, and other aspects of the health insurance, I'm going to pause and see if there are any questions. And I want you all to understand that these metal levels are the same, whether they are in a state exchange or a federal exchange, that up to this point, everything that we've discussed is the rule of the land across the country. Does anybody have any question?
Actually, I have a question. Do some companies offer both on exchange and off exchange, or do all companies offer on and off exchange so that it's possible to have the same insurer, whether you're using an Obamacare insurance or you're using insurance, directly from the provider?
Yeah, so yes. So the answer to that is, let's take, for example, Blue Cross Blue Shield. Blue Cross Blue Shield may have a defined plan. Maybe it's called the Blue Cross Blue Shield Apple plan. That Apple plan is an exchange item plan that has certain parameters, it has certain costs associated, and the design of that plan is specific for an exchange. Blue Cross Blue Shield in the same market might have the banana plan, which is not designed to meet the qualities necessary for the exchange. It could be richer, it could be not rich enough to meet the requirements of the exchange, and that would be offered off exchange. There is a difference often in premium. There's a difference also in commission to the agent, and there's a difference in plan design. So one carrier like Blue Cross Blue Shield can have both on and off exchange items. The only items that we are interested within RabbittApp are those that are on exchange. RabbittApp does not participate in off exchange items.
I also heard, thank you for that. That was really helpful, especially with the apples and the bananas. Healthy foods. I also heard something about there's an average plan. The silver plan is the one that everything else is based on, or I'm not really sure, but I know I heard something about that.
Yes, so as we go through the presentation, we will start hearing things, terms like deductible, coinsurance, total out of pocket, and subsidies. Everything that we will start talking about a little bit later will be based off of the lowest priced silver plan in the particular market. So if we are in Delaware County in Pennsylvania, where the office is located, When you look at an exchange item, and Pennsylvania is a federal exchange item, you will see that all the subsidies, coinsurance, deductible, out of pocket, everything is, the subsidies are all based on the lowest price silver option for the individual in Pennsylvania and Delaware County. So that becomes the benchmark. A bronze level plan, you do not qualify for subsidy and other cost sharing. Silver is where you start getting the benefits of being a slightly lower income and within the subsidy level. At the silver level, that's your benchmark. That's where you start getting access to those relief of payment.
Oh, great. Thank you for that. I was always curious exactly how that worked. Thanks.
Yeah. Anybody else have a question?
Yes, I do actually have a question, Betty. This is Jose.
Hello.
Hi, how are you? I have a question regarding, it's fairly simple actually. If someone applies, let's say in Pennsylvania, with your example that you mentioned earlier, and they move to a state that only uses the federal exchange, would that make any difference, or would they have to make any changes to their insurance?
Yeah, typically, even if no matter what insurance plan
Hmm.
you would purchase, I live in New York, so if I purchased an insurance plan in New York, when I established residency in another state, I would have
Hmm.
to, eventually, I would have to pick up that state's health insurance plan. If I
Okay.
was in Pennsylvania, which is a federal market, and I moved to Florida, which is a federal market, the types of plans being offered are going to be completely different. For example, in Florida, there's an insurance company called Molina. That doesn't exist here in New York. So health
Okay.
insurance is very quirky and it is very, very geographic specific. So as you start working within RabbittApp, you will see that you'll find a community in Texas that only has Blue Cross Blue Shield and doesn't have any
Wow.
other name brand product because that is specific to the geography or the location of the market in Texas. When you go to Florida, you're only going to see Blue Cross Blue Shield and Molina. When you come into Pennsylvania and you look at the carriers, in Pennsylvania, maybe you'll see another 3 or 4 different carriers, which is an insurance company. You'll see other plans offered by other carriers besides Molina and Blue Cross Blue Shield. So
Hmm.
big lesson is that insurance is very geographic. I live probably 2 hours away from you. I don't have the same insurance options as you do. We
Hmm.
have very, very unique options depending on where you live. That was a
Oh,
good
wow,
question.
that's very interesting.
Yes, that was a good question. Eric, any questions?
I was wondering how Aetna leaving the exchange would affect things.
Sure. So Aetna leaving the exchange is has made everything very difficult. There are examples of counties in this country that do not have any insurance available on the exchange, whether that's state or federal. What that means is for the individuals living in that community, they have zero access to subsidies and cost sharing that's part of the package of the Affordable Care Act. And let me go back for a second and talk about that. When you are purchasing a product through the Affordable Care Act, it's an individual product, right? It's not a group product. I'm not buying it through my company. I'm buying it directly into a marketplace. Because of the laws and the desire of the Affordable Care Act to make health insurance affordable and attainable for everyone, the government has set up certain income benchmarks that dictate whether or not they will share with you in the cost of your insurance product. So you'll see examples where, let's say for round numbers, the insurance for your family of 4 costs $100 a month in a premium. But because of your income level and the size of your family, the number of dependents, you might qualify for $800 in subsidy and only pay $200 a month for that particular insurance plan. So the Affordable Care Act does its goal is to make health insurance affordable. The way that they dictate that health insurance becomes affordable is that there are benchmarks based on your income and the size of your household that will dictate the subsidy level, the amount that the government is going to participate in the payment of your plan. And so you will see in other examples, when we get into the functionality of RabbittApp, you will see plans that will start off at $1,000. And then when you put in the income that the person is reporting and you hit next, literally you'll see a line crossing out the 1,000, and they will the price will be 200 because the government is subsidizing that insurance plan by $800. And I don't know if I answered the question because I already forgot what the question was. So tell me if I need to answer anything else on that.
That was
Yes, I
very
think you
helpful.
did.
Okay, so let's go on to the next slide. And so here we're talking about the different levels that the Affordable Care Act has as far as its categories of insurance plans. And I have to click here. Okay, so the next slide is what types of insurance plans are there? And you'll see on RabbittApp that the insurance plan might say Blue Cross Blue Shield, HMO, Blue Cross Blue Shield, PPO, or Blue Cross Blue Shield, HSA. I don't want to take a lot of time in this presentation. You have the definitions in front of you. It is a different type of insurance that is across the board, across all the insurance companies. They all use this terminology. If you belong to an HMO, whether it is Cigna, Aetna, Blue Cross Blue Shield, Molina, it means that you have access only to a particular grouping of doctors or hospitals, and your care is only covered when you use that provider, that grouping of doctors and hospitals. HMOs typically do have lower premiums and either low or no deductibles. But an HMO is a health maintenance organization, and it's a type, a category of insurance that goes across the entire spectrum of health insurance carriers. PPO is a little bit more liberal in who you're able to choose as a physician or as a hospital. It's a little bit larger of a network. And it often offers you out of network benefits. That means that if you want to go see a doctor that isn't part of the PPO, that you have a separate deductible, a separate coinsurance, but you do get some insurance relief if you want to see somebody outside of the network. And an HSA is a different type of a health insurance plan, and it is more of a tax-free incentive of how you use an individual uses their own money to pay for health insurance. So these you might see, and you will see, Blue Cross Blue Shield, HMO, Blue Cross Blue Shield, PPO. You're never going to need to be able to explain this to an agent, but we just want you to have an idea of what the different types of insurance plans are. The next screen are what are the insurance terms that you already are hearing me talk about. When you look at your insurance card, you might see it says for a copay, it might say $10, because I'm 100 years old, it used to be $10. It would say, let's say $50 primary care and $100 specialist. What that means is every time you go to a primary care office or a specialist office, there's a flat amount, a fixed amount, 50 or 100, that will tell you what, or tell the doctor's office what you have to pay as your portion, as the individual's portion for that exam or for your prescription. A copay is a fixed dollar amount. You might hear the words coinsurance. Coinsurance is different than copay. When you see the terminology or the description of the plan benefit, it might say this plan is an 80-20 plan. That means that the insurance company is going to cover 80% of the allowed costs of the exam, and the participant, the individual, is going to be responsible for 20%. Very common today are 70-30 splits. So if the contracted amount for an MRI is $500, the insurance company will pay 70% of that 500, and the individual is going to be left with a 30% responsibility as far as their coinsurance. And you can see that that's different than a fixed amount of $50 and $100, depending on the doctor's office you're in, that I used in my first example. Coinsurance gives you a wide exposure to the costs of care. Now, both coinsurance and copays come after a deductible. The deductible is the amount that the participant, the individual, has to pay for a healthcare service before health insurance kicks in. So if I have a $5,000 deductible, that means that for the first $5,000 worth of care, I have to pay that fully. 100% is my responsibility as an individual. Now, the important kind of nuance here is that my insurance carrier went to my physician and set up a contracted rate for all of its services. So the insurance company goes to the radiology facility and says an X-ray is going to be $50, an MRI is going to be $500. It doesn't matter what the radiology practice chooses to list their rates as. All these rates are not dependent upon the radiology center to choose. It's a contracted rate. So when I have to pay my first $5,000, I am paying it as at the contracted rate. I'm paying it at the same rate the insurance company would have to pay. So it is discounted, but my overall, if I have a $5,000 deductible, I have to pay $5,000 of my care until my insurance company steps in which point I'll either have a copay or I will have a deductible, and I mean a coinsurance. And I'm going to pause over here because I'm thinking somebody might have a question on this.
I actually don't, because I use insurance and I've had to deal with each of those terms.
Yes, exactly.
Sorry to say, but happy to say, I guess.
No, unfortunate. Anybody? So if nobody has a question?
Nope. No, ma'am. We're good on. Well, I think I'm good. Jose, Eric. Eric just said
okay.
he was good.
Okay. All right. So now let's go on to the term premium. The premium is the amount of money an individual or a business must pay for an insurance policy. The premium is the monthly cost of your plan. Before you go to the doctor, before you get sick, before you break your arm, how much are you paying every month for health insurance? That's the premium. The Affordable Care Act sets or uses the federal poverty level, the FPL, which is a benchmark of gross income that qualifies you under the Affordable Care Act terms for a premium tax credit or for any kind of subsidy that is on the exchange items, right? So when we talked about the fact that my plan is $1,000, I have X dollars of income that I will show on RabbittApp, and then suddenly RabbittApp is giving me a subsidy because they've calculated the federal poverty level of my income, my number of dependents, and they have given us the dollar amount in subsidy that is reduced from the premium plan. So now we also have the terms of cost sharing reduction subsidies, and these are refer to the subsidies or the discount that you are getting off of deductibles, coinsurance, and copayments. So there's a subsidy which deals with the premium, and the cost sharing deals with the other cost that a person has, the deductible, the coinsurance, and the copays. So those are terms that you just need to be familiar with, because as we are processing applications on RabbittApp, you are going to be looking at what is a premium tax credit, or are there tax credits that you're going to be seeing through the enrollment period. And what you need to know from here, the basic information, no one's going to ask you to calculate anything. You are going to just understand that all of these terms come from the amount of income and the amount of dependents in a household. So once you enter that into RabbittApp, then automatically you are fed the information on what the cost sharing is, what the premium subsidies are, and you just need to know that the tax credit is, or the income when you input it, is really what drives these discounts or cost sharing.
Hey Betty, I actually have a question here. Is there a difference between a tax subsidy versus the credit? Are they one and the same, or is there a nuance between them, or do people just use them interchangeably?
I believe that people will use them interchangeably. You do not have to, I don't even understand. I'm sure there's a nuance between them, but
Okay.
it's basically all you need to know is that when you put in an income level and the number of dependents, you're going to
Mhm.
see the costs. If they qualify, you will see the costs be reduced. And
Got it.
that's as far as we need to go on this discussion. You know what I mean?
Perfect.
Without the
Good.
nuances of what the next level is. Um,
Great. Thank you.
yeah. So as we've been going through this, we're talking about the ACA, and then I'll say Affordable Care Act, and then I'm saying Obamacare. It's crazy because everybody uses all of those terms interchangeably, and they are basically interchangeable, or those three words are completely interchangeable. When we speak to agents on the phone for RabbittApp, people might refer to submitting an application into CMS. I was just saying CMS before when I was on a call, or the FFM, or healthcare.gov. For all intents and purposes, for us, for RabbittApp, every time somebody says CMS, FFM, healthcare.gov, they're talking about the exact same thing. They're talking about the marketplace. CMS is the Center for Medicare and Medicaid. They're responsible for the rules. They set up the federal funded marketplace, the FFM, and the website for the FFM is healthcare.gov. So agents and individuals and the newspapers will randomly talk about the access to the exchange, which is through the web portal, is healthcare.gov, but the FFM is the actual it's the actual space behind healthcare.gov, and the person that built that, or the group that built that space, is CMS, and so people use those terms interchangeably. I'm telling you now that the most frequent time you will hear these is the FFM is down, or healthcare.gov is down, or CMS is making me crazy because the FFM is always down. In that context, everybody's talking about the same thing. They're talking about the actual website where you can go and purchase your health insurance product. So now we're on the same page. The Center of Medicare and Medicaid has established this marketplace, this mall of insurance carriers, and this mall of insurance carriers are, you gain access to them through healthcare.gov. The mall is designed so that each individual has basically their own price point. There's a fixed price for the cost of insurance in each individual county, but based on your individual needs, whether you, based on your income and your number of dependents, we're going to fluctuate what your actual cost is. And you're going to be able to participate in a subsidy program where a $1,000 product is going to be reduced to only $200 a month because of $800 in subsidies. That sounds great. So that means that every individual in this country has the opportunity to go and pick up health insurance at potentially reduced costs and gain health insurance for their selves and their family. Well, the Affordable Care Act, the CMS, when they designed the Affordable Care Act, does not want you to wait until you are sick before you decide you're going to pick up health insurance. And with great reason, right? I might feel like I'm getting dizzy. I feel like I need to go to a neurologist. I don't have any health insurance because I've been perfectly fine up until now. And they don't want the process to be that I can call up, hi, Aetna. Yep, I think I'm going to go to the doctor tomorrow, so I want to pick up my health insurance today. Clearly, only sick people would have health insurance at that point, and everybody healthy would wait until they were riding in the ambulance suffering a heart attack before they would purchase health insurance for themselves. In order to avoid this calamity for health insurers, the CMS established Affordable Care Act, or ACA, enrollment periods. And they call the period in which everybody can come and access my beautiful mall of health insurance, they call that time period an open enrollment period, which means that I don't have to present any special circumstances. This is my Black Friday. I'm able to go in and I'm able to go and purchase everything just during the time period of November 1st until January 31st. That's the only time I can go in without any special reason, because it's totally open. I'm able to go in and purchase my health insurance without having to prove anything other than I'm a citizen who's not in jail and I don't qualify for Medicare or for CHIP. So the important dates for enrollment for 2017 are November 1st, which means that open enrollment begins and I can apply for new insurance or change the coverage that I had previously in a past year. I have up from November 1st to December 15th to gain coverage that would begin on January 1st, 2017. So if I go and I purchase a health insurance product on November 3rd, I do not have access to that product until January 1st of 2017. So up until from November 1st to December 15th, I am able to get coverage that starts on January 1st. If I apply for that coverage on December 16th, my coverage will likely not start, unless there's some waiver, until February 1st. So in December 31st, the coverage period for 2015 plans end. And the government has decided that they are going to auto-renew you into a plan if you haven't gone in and touched your plan or changed your plan. January 31st is the last day that you can apply for 2017 coverage before the end of the open enrollment period. Okay? It's the opportunity that this time period that everybody in the country has access to health insurance, and the government feels that if you did not participate in picking up health insurance by the end of 2016, you're going to be fined 2.5% of your total household income, or $695 per adult, whichever is higher. So that is the rate that is called the individual mandate. And if you did not participate in the open enrollment period, if you did not choose to get yourself health insurance, you are going to be subject to that fine. So this open enrollment dates are important for everybody on this call and people watching this video, because December 15th, everybody suddenly wakes up and every broker is like, oh, I have these 300 applications that I need to process by the end of the day today. And the reason is, if they don't process it by the end of the day on December 15th, then their clients are not going to be covered with health insurance until February of 2017. They will have lost the month of January. Brokers usually figure out that the calendar says December 15th at around 12 o'clock in the afternoon, and they have only until the end of the day, until midnight that night in their time zone to put in all of their applications. So December 15th is usually a panic day. And as far as your own life planning skills are concerned, everybody works very long hours on December 15th, and really the 13th, 14th, and 15th, as brokers are putting in their stockpile of applications that they had not done in the past. So your hot dates are December 15th, a little bit less on December 31st, and then January 31st, and the month of January is less, because they most of the insurance brokers do most of their business by the end of the calendar year. So does anybody have a question on open enrollment?
No, but I apologize for the typo on the date in there.
That's okay.
No,
Um,
ma'am.
okay,
No
good.
questions thus far.
All right. Let me see if I can get to the next page. There we go. Nope, that's not what I wanted. How do I go back? That's embarrassing. Okay. So the next slide is, what is the special enrollment period? So we talked about the fact that the CMS has established that the Affordable Care Act's open enrollment period, where everybody can come and pick up their health insurance, is November 1st till January 31st. But there are life events that occur that dictate that an individual should have the opportunity to purchase health insurance because of these life events. The life events that are recognized are losing coverage. Your employer stops offering health insurance, or you got divorced and your husband or your spouse does not support you on your health insurance, on their health insurance plan anymore, or your COBRA has ended and now you have no coverage. So losing coverage. Here is the question about moving from state to state. If I move from New York and I need to pick up a plan in Wisconsin, that is an opportunity. I don't have to wait until the open enrollment period in November to come. I'm able to apply for health insurance under the special enrollment period. If I leave a job, if I got married, if I have a baby, adopt a baby, or a change in income, I'm able to qualify for a special enrollment period, which means it's every other calendar day besides November 1st to January 31st that says, hey, I have a special reason and I need to pick up health insurance. And it is available as long as I meet one of these qualifying episodes. So that's going to end the portion of this part of the discussion that we are talking about traditional health insurance products. It's a network of physicians. I have a deductible, and I have out-of-pocket maximums that is clearly spelled out on every insurance plan. So I know that if I pick up a policy that has a $7,000 out-of-pocket maximum, that I know that no matter what happens in my health during that year, the most amount that I'm going to be required to spend on my healthcare is my premium per month plus this out-of-pocket maximum. So I cannot spend more than $7,000 above my premium on my healthcare, because after that $7,000 mark, my insurance kicks in 100%. And that's traditional health insurance. That's what you think of and I think of when you talk about Aetna and Oxford and Blue Cross Blue Shield and any other major carrier. But there's another type of insurance that's called supplemental insurance. Insurance brokers will refer to it either as supplemental or ancillary products. Whoops. So the supplemental insurance are products that are designed outside of the traditional healthcare model. They are really plans that fill in gaps that are left by traditional health insurance plans. And they're things that you and I would discuss as either life insurance, disability insurance, dental insurance, accident insurance. And we also offer on RabbittApp, we also offer short-term medical insurance. Now, they're separated out for a good reason. Short-term medical insurance replaces traditional insurance. So a broker might say that a person doesn't qualify for subsidy, they can't afford the premiums, or they're choosing not to participate in the healthcare system, but they want to have some insurance, some healthcare insurance that mitigates against the risk of getting sick. And there are short-term medical plans that fit that bill. They don't qualify you as having a full health insurance product. You are still responsible for the individual mandate. You are not getting what the CMS has dictated as appropriate medical insurance, but they fill a need, especially when the person cannot obtain or afford traditional health insurance. So this short-term medical insurance, you would equate it with being more like Aflac. Okay, so it's the type of insurance that's not coming from some of the major carriers. And supplemental insurance, life insurance, disability, dental, accident, those are insurance products that are designed to be sold on their own, but they certainly fill the gap with a traditional health insurance product. So I might have Blue Cross Blue Shield, but I still need life insurance, right? Or I might have Blue Cross Blue Shield, so I can go to the doctor and I have fixed rates, but what's going to happen to me if I get into an accident? There's no accident coverage under Blue Cross Blue Shield. Those are different. Those are different plans. So this is the category of what supplemental or ancillary products. That's where they fall. Some of the supplemental carriers that are in RabbittApp are Compass 360, which is a short-term medical product, Compass Express, which is designed to be sold with or without full insurance products that are offered on the exchange. And these carriers, ICANN, National General Dental, Unified Life, Life Shield, we will have a number of carriers, which are these insurance companies, that we host on the RabbittApp platform, and agents can choose to sell alongside of an ACA plan or without an ACA plan, and they just want to go ahead and sell supplemental insurance. So before we get to RabbittApp, I'm going to put a pause in.